Hi, and welcome to our presentation for Social Psych. We are presenting on The Healthy Life. My name is Aspen. We also have Liv, Abby, and Maddie. We're excited for you to join us today.
These are the 4 learning objectives from the chapter. The first one is to describe basic terminology used in the fields of mental health psychology. The second one is to explain the theoretical models of health, as well as the role of psychological stress in the development of disease. The third objective is to describe the psychological factors that contribute to resilience and improved health. And the last learning objective is to defend the relevance and importance of psychology to the field of medicine. Here's the table of contents. So we're going to go through 1 through 9. So about health psychology, stress and health, protecting our health, importance of good health practices, psychology, medicine, the future, COVID-19 impact, how-to list for you guys, and the conclusion.
So the first thing that we'll be talking about is identifying what health psychology is. So as of today, facing chronic diseases have become common among humans. Some chronic diseases may include coronary heart disease, that's the most common, along with cancer or diabetes. So how can we avoid having these diseases in our health? Well, that's where health psychology comes in. The definition of health psychology focuses on all chronic disease issues. However, there's a psychological focus that involves maintaining a healthy lifestyle along with preventing and treating illness. There are psychological and social factors that easily make influences among others. As for coronary heart disease, some of these factors may include stress, smoking, and unhealthy eating habits. Health psychologists go in depth to these concepts and look into the choices we make, behaviors we engage in, and the emotions we feel. All of these concepts affect our overall health. And that leads to the practice of the BPS model of health. BPS is biopsychosocial. In other words, biology, psychology, and social factors are seen in development of disease as biological causes. Now, this also leads to a mind-body connection, which is another way to dive into our thoughts and understand how we are feeling at the present moment between our mindset and body.
Okay, the next part we're going to be talking about is stress and health. So stress is directly related to our mental and physical health, both, and especially lately, you can see the impact of these things on the medical and therapeutic scenes. So whether that's in the doctor's office or at your psychologist's office, or maybe even in like a physical therapy sense. During the COVID-19 pandemic, many have become less active with their physical activity and their stress has increased a lot. It's definitely an impactful time for all of these things. Now, if you see here, we've got a couple of graphs that show some self-reports from participants of a study by Marashi et al. It was just done this year in April. And if you see on the left, the blue bar is levels before COVID and the orange is during COVID. You see a marked rise in sedentary activity and decreases in all other levels of physical activity. If you also look towards the right, you can see activity level in minutes versus mental health scores that they have self-reported. So if you see on the towards the right, anywhere from like no change, worse to much worse mental health, you see a negative decrease in activity minutes, which shows like the more sedentary lifestyle, the effect of stress on their physical activity levels. Physical activity is definitely a key function of health, as it's not only been shown to improve physical health, but psychological wellness and well-being. And their research shows that physical activity can help alleviate stress and anxiety, which is kind of a paradoxical thing because during the pandemic, stress has led to a decrease in exercise, but it also increases their stress because they're not exercising. So what do we do about that?
All right, so this is section number 3, which is protecting our health. And as you can see, this is all the components of resilience. So resilience is the ability to bounce back from negative situations, such as illness or stress, to normal functioning, or to simply not show poor outcomes in the face of adversity. There are 5 factors that are often studied in terms of their ability to protect our health. They are coping, control, self-efficacy, social relationships, dispositions and emotions, and stress management. Coping is how individuals cope with stressors they face and can have a significant impact on health. It is divided into two categories: problem-focused coping or emotion-focused coping. Control and self-efficacy is having the belief that you have control over a situation. Social relationships can improve your health from encouragement from those around you. Dispositions and emotions are how someone acts and what their temperament is. There are negative and positive dispositions, as they have been tied early on and labeled as type A and type B behavior. The negative behaviors are tied to health risks, while the positive dispositions are linked to a wide range of benefits, such as an increased longevity, a reduced likelihood of developing some illnesses, and better outcomes once you are diagnosed with certain diseases. Stress management is the last factor studied in resilience. Stress affects the body in many different ways, and there are a lot of different interventions to reduce stress. Meditation is shown to reduce stress significantly. Arousal from stress can be reduced via biofeedback, which is a technique where the individual is shown bodily information that is not normally available to them, for example, heart rate, and then taught strategies to alert the signal. This type of intervention has been shown promising in reducing heart and hypertension risk, as well as other serious conditions. Exercise is also a great way to reduce stress. Arita and Texiera Machado in 2021 concluded that regular physical exercise prepares the brain to be more resilient due to the cognitive impairment associated with physical activity. And in the next slide, we're going to play you a video by TED on the effects of stress on the human body.
Cramming for a test? Trying to get more done than you have time to do? Stress is a feeling we all experience when we are challenged or overwhelmed. But more than just an emotion, stress is a hardwired physical response that travels throughout your entire body. In the short term, stress can be advantageous, but when activated too often or too long, your primitive fight or flight stress response not only changes your brain, but also damages many of the other organs and cells throughout your body. Your adrenal gland releases the stress hormones cortisol, epinephrine, also known as adrenaline, and norepinephrine. As these hormones travel through your bloodstream, they easily reach your blood vessels and heart. Adrenaline causes your heart to beat faster and raises your blood pressure, over time causing hypertension. Cortisol can also cause the endothelium, or inner lining of blood vessels, to not function normally. Scientists now know that this is an early step in triggering the process of atherosclerosis, or cholesterol plaque buildup in your arteries. Together, these changes increase your chances of a heart attack or stroke. When your brain senses stress, it activates your autonomic nervous system. Through this network of nerve connections, your big brain communicates stress to your enteric or intestinal nervous system. Besides causing butterflies in your stomach, this brain-gut connection can disturb the natural rhythmic contractions that move food through your gut, leading to irritable bowel syndrome, and can increase your gut's sensitivity to acid, making you more likely to feel heartburn. Via the gut's nervous system, stress can also change the composition and function of your gut bacteria, which may affect your digestive and overall health. Speaking of digestion, does chronic stress affect your waistline? Well, yes. Cortisol can increase your appetite. It tells your body to replenish your energy stores with energy-dense foods and carbs, causing you to crave comfort foods. High levels of cortisol can also cause you to put on those extra calories as visceral or deep belly fat. This type of fat doesn't just make it harder to button your pants. It is an organ that actively releases hormones and immune system chemicals called cytokines that can increase your risk of developing chronic diseases, such as heart disease and insulin resistance. Meanwhile, stress hormones affect immune cells in a variety of ways. Initially, they help prepare to fight invaders and heal after injury, but chronic stress can dampen the function of some immune cells, make you more susceptible to infections, and slow the rate you heal. Want to live a long life? You may have to curb your chronic stress. That's because it has even been associated with shortened telomeres, the shoelace tip ends of chromosomes that measure a cell's age. Telomeres cap chromosomes to allow DNA to get copied every time a cell divides without damaging the cell's genetic code. And they shorten with each cell division. When telomeres become too short, a cell can no longer divide, and it dies. As if all that weren't enough, chronic stress has even more ways it can sabotage your health, including acne, hair loss, sexual dysfunction, headaches, muscle tension, difficulty concentrating, fatigue, and irritability. So, what does all this mean for you? Your life will always be filled with stressful situations, but what matters to your brain and entire body is how you respond to that stress. If you can view those situations as challenges you can control and master, rather than as threats that are insurmountable, you will perform better in the short run and stay healthy in the long run.
As we've talked just a little bit about the importance and the things that go into having good health, I wanted to touch now on some of the practices that can be done to form healthy habits and why that is important. So healthy habits is defined as any behavior that can hurt or harm your health. Examples of these fall into two different categories, some being positive, which is exercising, flossing your teeth, or wearing sunscreen, and others can be negative, like drunk driving, staying up all night, and smoking. After learning a little bit about the implications of stress, one research study that we found stated that students who were taking exams reported that they were more stressed than usual and were more likely to smoke, drink more caffeine, partake in less physical activity, and have worse sleeping habits. Stressful times like this compromise a person's immune system, like we saw in the video, creating a higher likelihood of exposure to illnesses and getting sick. This is why it is especially important in times of stress to practice healthy habits and protective behaviors. One of the ways to focus on healthy habits is through health promotion, which involves enabling individuals to improve health by focusing on behaviors that pose a risk for future illness, as well as spreading more awareness on healthy behavior. One of the ways that has been researched is by spreading health awareness in schools, specifically for mental health. An article that was published by Dix in 2012 looked at the impact that implementing a mental health initiative known as Kids Matter would have on kids' academic performance in school. They found that by spending time in their school's curriculum to implement mental health strategies, they helped the students improve their learning for an equivalent of 6 more months of school than they previously had. Overall, you can see that the focus on healthy habits and behavior provides many opportunities for growth and success. Now I want to talk a little bit about the psychology that goes into seeking out medical care. From the reading that was in the chapter, I kind of created my own 3 phases of the process of getting medical care. And the phases are consideration, research, and decision. Consideration is the initial step in thinking about seeking out medical care when you need it. There are a couple of factors that go into a person's decision to get care. Typically, older individuals, women, and those of high socioeconomic status are more likely to seek out medical care than other individuals. Other individuals who may need care might avoid it due to financial obstacles or preconceived notions about medical practitioners or the illness. The second phase is research, which is how people go about discovering health information and knowledge for themselves. This is mainly done through the internet or advice from someone that they trust. Most people nowadays turn to the internet for their health information, and about 38% of them would say that's what influences their decision to see a doctor. Relying on the internet has its pros and cons, however. Most people do not do the best job at checking credibility of health information or the accuracy of what they are learning. Often people are influenced by the web designer logos rather than the content. It is a convenient and an easy source for people to turn to look into more information about health. A recent study done on the importance of health information talked about how there's a great need for education on health issues and being able to connect to support groups so that it can provide opportunities for them to get better. The third phase is decision. There are 2 parts to the decision-making process, one just being whether or not you choose to seek out medical care, and the other being whether or not you decide to follow a doctor's orders. Often, there can be variability in the information that is given to a medical provider, potentially due to poor communication from embarrassment. This decision to withhold information can cause misdiagnosis affects the accuracy and effectiveness that the treatment can be given from the medical provider. Another aspect of the decision process is after a diagnosis or health recommendation has been given by a doctor, the individual then must decide to what extent they want to adhere to the medical recommendations. For example, they can decide whether or not to take the medication appropriately or the failure to continue, change, or implement new behaviors. Medical professionals have realized that getting patients to follow medical orders is not as easy as one might think, but with the advancement in technology, monitoring patient progress is becoming much easier to do. In the next slide, there's a short video that goes into this medical care process with a patient who has been referred to a certain kind of treatment for her MS.
Hi, my name is Dr. Amy Sullivan, and I'm a psychologist and the Director of Behavioral Medicine, Research, and Training here at the Mellon Center for MS. Today, we have a patient, Sherry. Sherry was referred to behavioral medicine by her neurologist. Sherry, thanks for joining us today.
Thanks for having me.
Yeah. You were referred to our section of medicine, behavioral medicine, by your neurologist. Do you understand why?
Well, I was wondering that why she would send me to a psychologist. I was thinking, does she think I'm making up that I have MS, or am I crazy and need a shrink?
Yeah, these are common concerns. One of the things that I often hear in my practice is, why am I being referred to behavioral medicine? What we find at the Mellon Center for MS is that we are a multidisciplinary team. We treat MS patients in a variety of different ways. We have a research center, we have neurology, we have physical medicine and rehab, and we certainly have psychology services. Psychology services are very important for the MS patient because what we see is that people with MS have a higher prevalence of depression and anxiety. Do you understand what depression and anxiety are?
Could you explain those to me?
Sure. So depression and anxiety are ways that people feel in response to an actual event. So if a person is diagnosed with MS, we oftentimes find that the person will have greater prevalence rates of depression or anxiety for a number of different reasons. One may be that they're having a difficult time adjusting to the current diagnosis. Another might be that their disease-modifying therapy, things that you may be taking by the discretion of your doctor, cause changes in the way that we think or feel. And another may be neurochemical changes or changes in the brain due to your MS. So you were referred to us because we want to help you to treat the depression and the anxiety. Thank you very much for watching. I hope this has been helpful for you. If you have any questions or need additional information, please visit the website, which is listed below.
So that jumps us into the future of health psychology. And as seen in the video above, you see the successful integration of the medical field and the psychological field coming together to provide better care. In such instances, it's been very helpful in kind of dispelling any anxieties people have about going to the doctor, any stigmas attached to that, and just making it easier for accessible care to happen. So medical and psychological interventions have been slowly coming together over the past couple of decades, and the importance of these two fields and their impact together has had a huge impact because of the COVID-19 pandemic. But what exactly does that mean for the future of health psychology? Hopefully that just means that we'll see more integration on a widespread level throughout both the medical and psychological communities. And we've already seen some of this interaction, not only with medical offices, but physical rehabilitation centers and kind of the use of health psychologists or counselors with their patients. So this next slide here kind of delves into the two sides to health psychology and its role in modern medicine. So we have clinical care and public health that are two different aspects of healthcare currently. And an article by Halakidis in 2020, just last year, I outline these differences. So with clinical care, it's going to be more about treating illness and more focused on individualized care for one person rather than a group. And public health is going to be more about prevention of illness aimed at a population. So more like what we see with the COVID-19 health pandemic, with all of the mandates about mask wearing and just general guidances about hygiene and ways to prevent the spread. So better focus on the psychosocial and socio-environmental causes of these issues are kind of what help bring these two fields together. There's been some initiatives by the American Psychological Association. There was one back in the 90s that didn't really stick, but just really creating more integrated space for these two fields to interact with each other and create a mixed field instead of treating them as separate entities has been very helpful in the field of medicine.
So this is going to be the section on the COVID-19 impact. So all the ways to build resilience is directly affected by the global pandemic. And in a recent study conducted in 2021 by Fukazi et al. During the global pandemic found that one of the given ways to build resilience, coping, is not enough for some. With over 2,000 participants, Fukazi et al. Found that coping mechanisms were not powerful enough for individuals to fight depressive symptoms. Also concluded that medical help should be sought when coping mechanisms fail, and suggests that all these skills are not powerful enough. During the pandemic, millions of people could not gather in groups to gain social relationships they need in order to fulfill a healthy life. Philpott et al. 2021 research found that COVID-19 social support was needed more than ever because of social isolation during the pandemic. Social support gives emotional help, tangible help, and advice, and everybody was lacking in that. There's a lack of control in individuals' lives due to the pandemic, knowing what will happen, the lack of control over situations and things closing. This all causes not knowing and not being in control of one's future. Not being able to go outside and work out in a gym makes stress harder to manage. Physical activity helped many manage stress, and now the closures of gyms make exercise even harder than ever. And lastly, when people are locked in during the lockdown, people cannot go outside. This causes individuals to not be as happy and lose optimism. Their emotions and dispositions change. Optimism has been shown to improve coping, reduce stress, and predict better disease outcomes, like recovering from a heart attack more rapidly. Now, since the pandemic, people are less optimistic that things are going to go back to normal.
There are many ways to take on a healthy lifestyle. You can include exercising regularly and taking some time to meditate in order to reduce stress. But if you need help, like seeing a professional can help you talk through your thoughts and feelings, especially since the pandemic has made an impact on so many people. But on a more specific note, an outside link was presented in the chapter that showed all of these apps available to help you take the first step of action of wanting a healthy lifestyle. All of these things help with nutrition, workouts, runs, general body check-ins, and some symptom checkers for when you're feeling ill. All of these apps will bring guidance and awareness to how you want to become more healthy. Thank you for tuning in today. We hope you learned something about the healthy life. Thanks.